Today I do want to focus on erectile dysfunction. Now, a lot of guys might have a different definition of erectile dysfunction, but basically it's any problem with your erections that does not allow you to get what you want out of a sexual life. Erectile dysfunction is a lot more common than people might think. It's just that guys don't usually talk about it. When Viagra came out back at the turn of the century, guys started talking about it a lot more, but still, it's more prevalent than you might think. The main cause of erectile dysfunction is basically lack of adequate blood flow to the penis. This can be caused by medical conditions or medications. The two most common medical conditions are going to be high blood pressure and diabetes. Erectile dysfunction can be diagnosed in many different ways. Mainly, it's from the patient's testimony, how they feel their erections are working for them. We do have some diagnostic tools within the clinic that can also help delineate and determine what your specific cause of erectile dysfunction is. A lot of people will ask if erectile dysfunction can be prevented. Well, of course, a healthy diet and lifestyle can help prevent erectile dysfunction, but many of the causes are actually out of the patient's hands. Although erectile dysfunction is actually very common, in the primary care setting, it's not treated as much as it should be. A specialist has all the tools for getting your erections back. As I mentioned earlier, erectile dysfunction is very common. The good news is that there are many good treatments for erectile dysfunction. Those treatments range from pills all the way up till surgery. Now, you should talk with your urologist to find out which of those treatments is best for you. When you talk to your urologist to try to decide which of those treatments is best for you, your urologist will ask you many different questions, possibly an examination or maybe some testing. But given all the good treatment options, there will be one that can get your erections back. Although there are many different treatments out there for erectile dysfunction, the satisfaction rates are going to vary depending upon the patient, how severe the erectile dysfunction is, and what the desired goal is. So be sure and talk about that with your urologist so you'll have full information. Now, although many guys may say, I'll get my erections fixed down the road sometime, it is important to point out that there may be some long-term consequences of not addressing your erectile dysfunction up front. One of those consequences is fibrosis or scarring within the penis, which can lead to penile shortening. So at least give yourself the benefit of talking with your urologist early on so you'll be fully informed.